Welcome to my channel. I'm Dr. Terry Loy, the Texas Tooth Lady. Today is going to be really interesting. I'm going to show you a patient that has tartar to the likes, honestly, that I have not seen before. It covers her entire teeth, and I cannot wait to show you how we're going to change this person's life just by removing the tartar. She can actually feel comfortable when she eats and speaks. Hi, how are you?
Good, I'm good.
Okay, what brought you into our office?
I have just been in pain for months now, and I'm just tired of it. I can't eat right. I don't know what it is to have a burger in like 5 years, honestly. And I'm ready for a change. I need this to go away.
Okay, so we examined you, and it's been a while since you had your teeth cleaned, but not everyone that has their teeth cleaned has issues. But for some reason, you accumulate tartar very easily, right?
Yes.
Okay, so I'm going to go ahead and show the viewers, go ahead and open, what this looks like. So when you look into her mouth, all of this is tartar. And we are going to show you how we remove it and what it's going to look like after it's all removed.
So as you can see, our patient, it's been a while since she's had a cleaning. So what happens is the plaque that is not removed from the teeth, meaning the food and debris that is not brushed away, builds up on the tooth. It can only take up to 12 hours for it to harden into tartar, or what is now called calculus, which is this hardened form of plaque that you see. The bacteria that associated with this plaque and tartar is what eats away the supporting structure around your teeth. So once it forms into this, you cannot brush it or floss.